asking the question is patient care. So yeah, anybody can ask these people because they rolling up in the bins doing all this shit. Just tell me how much the motherfucker costs. Okay, so basically what you're dealing with when you look at insurances and changing the subject, and we don't really need to talk about your insurance, is the patient is all about the insurance, because if they can't afford it, they're not gonna buy it. And everything you thought you did to help them is gone. They're not finna do it. I know I wouldn't if I couldn't afford it. You told me something was like, thousands of dollars and I'm broke. Bitch, get the fuck out of here. Okay, so that's just real. Okay, so think about those things when those drug reps come. Always, 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 always be the one in the crowd to say, how much is it without insurance coverage? Always. Because that's what your patient gonna ask you. That's exactly what your patient gonna ask you. And we got a lot of self-pays at the clinic. Okay. All right, so here we go. Automatic responses. The number one automatic response, I saw this with advance directives. Your patients, they have passed a law that you have to address advance directives. So now the front desk staff addresses advance directives, and the patient kind of knows about advanced directives. But you get those patients that don't know anything. You got nurses like that too, but you get patients that don't know shit about advanced directives. And so when you get this patient that doesn't know anything about advanced directives, and they ask the nurse who doesn't know anything about advanced directives, what's advanced directives? And the nurse says, and this was an automatic response, oh, just some new policy we got to ask you about. Don't worry about it. I saw that a million times. They had no idea what it was, so they decided that's how they're going to answer it, right? Just some stupid policy that they came up with, or just some new law. Just sign the paperwork. You'll be okay. Don't worry about it. I mean, it's nothing big. It's like nothing. I saw that all the time, okay? Because they just didn't know what it was. They didn't know how to explain it. And now you, of course, do. We did it yesterday, but they didn't know. The other one is the thing about the staffing. We're short staffed is an automatic response. There's another one on here that I like that I hear all the time. Let's see. Oh, generalizations and stereotypes. Old folks can't drive is a good one. Now, that might be true sometime, depending on what you're doing. I've been in Lyndhurst, and there's an extremely high amount of senior citizens, and if you get up out of here on Sunday, you're going to be driving 10 miles an hour all up and down Mayfield. So, you may have a little problem with a few old folks, but you still can't do the generalizations. Another generalization is that just because you're old, you're senile. And that's definitely not true. For better or for worse, some of our Supreme Court justices served till 102. In fact, ex-KKK Strom Thurmond did that, right? So you want to know that if you are so senile, why are you running the Supreme Court, right? Till you die, because that's your appointment. You can be on there till you die, okay? All right, so for better or for worse. Okay, so you get it. Now, so none of that. False reassurance is the thing I see the most. One of my students had this happen to her and called me crying. She had miscarried 3 times in a row. The 3rd time she was in my class, bleeding again. She went to the bathroom. She's bleeding like, oh no, it's happening again. So she went, she called her doctor. They wanted to get a human chorionic gonadotrophin blood draw. So that's a HCG, not UCG, not urine, but blood. As you know, they're going to follow those levels. So she went to go get her HCG drawn, and the lab tech said, oh, don't worry, I'm sure your baby's fine. She was like, I know my baby's not fine. Why did she say that? Does she know something I don't know? And she was from Thailand. Does she know something I don't know, Shelly? I was like, no, that was false reassurance. And because she confided in me about that situation, and I didn't know about the other 2 miscarriages, I got her the help that she needed that her doctor didn't do. So we got her to a reproductive endocrinologist, because if you miscarry more than twice, you need genetic workup. And she has a son now. So you need to refer the patient where they need to go. And she needed somebody to work her and her husband up genetically. Both her and her husband were in the class together. So you don't want to ignore the fact that she keeps miscarrying. That's not normal. Okay? So the false reassurance. Some of you guys say things like, and you mean well, but you don't want to do this. God will not give you any more than you can handle. Well, to some people, this is more than I can handle. Okay, so that's not a good statement. That's another example of false reassurance. Another one is, I'm sure it'll all work out, or here's one. Everything happens for a reason. Don't do that. Please don't do that. That doesn't help anyone. Okay. All right. Now, you see sympathy. We talked about that. What was the difference between sympathy and empathy?
Sympathy, you're breaking the rules.
Breaking the rules, or?
You said like you were going to take them home with you, and then empathy is more like you're going to.
What was the one word that you did that was not good with sympathy? It was one word we said that made the difference. The word starts with a B. You're crossing boundaries. You're crossing boundaries. Remember that word. You are crossing boundaries. When you do things that out of sympathy, you're crossing boundaries. Things that you normally would not be doing. Empathy, on the other hand, is not crossing boundaries. It's letting the person know you care. It's walking a day in their shoes. It's putting yourself in their position and trying to comprehend what they're dealing with. That's empathy. Sympathy is you cross boundaries all the way. Okay? All right, so remember that, because that's a hard one sometimes on the test.
Is sympathy where you said yesterday, like you feel like you want to take them home and take them in? Okay.
Yeah, and yes, so empathy for me would be, I've taken photographs of all your bruises because you're beat up by your significant other, and your safety plan is you got an extra set of keys, an extra driver's license, clothes for all three of your children, and I kept it in my office here as a nice little place away from where he would even know to look. And then that's empathy. Sympathy would be, I went to your house, picked you up, took you to another city, set you up in a hotel. I mean, you're just crossing all kind of boundaries. You know, you're doing too much, as we say. You extra, okay? All right. And nurses get caught up with that. They do. They get caught up because you love so hard and you care so much that you're just trying to go way overboard, okay? And that's not necessary. Okay, asking for explanations. Everybody in this class, I think, knows that you cannot have anything on the test, don't click anything on the test that asks the question why. Don't do that, right? If it starts with a why, it's not to be chosen. So don't do that. So that's asking for, what it is really confrontational. Well, why didn't you take your blood pressure meds? Well, why didn't you make your appointment last week? But I mean, that why is just loaded, right? Don't do that. Don't confront people like that, okay? So that's important. The next one is approval or disapproval. I see this when, you know, your patient's doing the drug thing or whatever they're doing. They getting high, doing whatever they're doing. So now it's different. It's a little different when you explain the health issues associated with you doing this, whatever you're doing, versus, for real, you getting high, huh? Oh, you smoking? Oh, for real? Okay, well, that's stupid. No. I see here that you said in your history that you smoke a pack a day, and you are getting a colonoscopy today, And I want you to know, if you can, if you really want to, some people don't even want to. They say this all the time: you gotta die of something. And those people are fine. That's America. Let them do what they do. But in as much as we're nurses, we have a responsibility to explain to our patients that if you have any desire to quit, and if you could quit, that would help tremendously. They did find 2 polyps today. Polyps and colon cancer are related to smoking. So if you can find a way to stop it, that would be ideal. Well, my friend had a lobectomy for for a mass. And you know, she already knows, I gotta stop smoking. I mean, she already know that. So, but some patients do not understand that drinking is directly related to breast cancer. They don't have any idea of that, because for all these years, they've heard it's always the cigarette. Well, it's actually a lot of the alcohol. Alcohol is a carcinogen. What does the word carcinogen mean? Cancer causing. We've tied it to causing cancer. It's a carcinogen, just like nicotine. So, but you don't hear that very much. And so I find that my patients have no fucking idea that cancer is caused by alcohol. I find that my patients, and this is probably the most shocking thing I found in my work in endoscopy, I have found that patients have no idea that alcohol is directly the cause of their esophageal varices that we're about to ban. So we're going in here getting a banding, and you don't even know what caused this, because it's been my experience that I have yet to see a doctor address it. And I'm talking about world-class care. I have yet to see a doctor address alcohol for these patients. I have yet to see a doctor address the use of NSAIDs with the GERD patients. I have yet to see anybody talk about smoking or drinking with either of the GERD patients, or the kind of confusing and concerning to me as a nurse. So we just getting these procedures done, getting that bank. That's what's happening. We just getting that money, and we're not really invested in the patient and curing them and stopping the nonsense. What is that about? Nobody yet in the 4 years I've been there has talked about nutrition. Nobody. What are we doing? Now, your other countries with better outcomes, including France, Germany, Denmark, Norway, Austria, and England, their statistics are way better than ours in terms of health, because they do some teaching. In fact, their doctors don't get paid very well or bonus out unless their hemoglobin 1Cs came down. Their hemoglobin A1C's got to come down. The cholesterol's got to come down. The BMI's got to come down, because otherwise, what the fuck did you do? Nothing. It's not based on procedures. It's based on how healthy is your population of patients compared to your benchmark, compared to your partner over here who showed us what he working with. He had no breast cancers for the whole year. You see what I'm saying? The bonus is based on health, not sickness. Yes, baby.
I was just gonna say, I see this a lot because I work in hematology and oncology.
Oh.
So we have a lot of palliative care patients.
Yes.
So sickle cell and then cancer, obviously. And they get so upset with us because we have to monitor how much they're smoking. Even though it's legal now, they argue with us all the time. They're like, why do you care so much? It's legal, it's my business. And I'm like, we can't prescribe the amount of pain meds that you're asking for on palliative care because we have to monitor how much you're smoking.
Exactly.
And then we draw labs and do all the, they go to drop the urine and stuff, and it comes back off the charts. And they're like, you're not smoking a little bit, you're smoking a lot of it. Like,
now that's my question.
Down.
Can you look in the urine and see how much then? How do you do that?
There's like a number that comes back on the report.
Okay.
And each like percentage shows the doctor like how much they're smoking a day.
Wow. So instead of the qualitative data that you're smoking, it's positive for THC or whatever, it comes back how much.
Yeah, like
that's what's up.
Like a percentage. So like then we get, as the clinical staff, staff, we get the messages in our inbox to call the patients and let them know, like, hey, like, I know you told us at your appointment that you're only smoking 1 joint a day. Like, we know you're lying. We can't continue to care for you on a palliative level if you don't, you know, you signed a contract with us. You have, like, you have to do what you
knew
said.
up front.
And so, like, well, then they go through and, like, they'll say they cut back, but they never do.
No.
But to them, you know, like, especially the sickle cell patients, they're in a lot of pain.
Yeah.
So they're like, well, I've always used that to medicate. And I'm like, I understand that.
Yeah, a lot of people do.
If you want the extra now,
you got to pull it back.
Yeah, I mean, the laws are so strict with the providers, obviously, for giving this. Even, like, the methadone clinic. I have to call the methadone clinic all the time because we have to correlate with the methadone clinic and giving extra pain meds for our palliative care. Like, we have to be in contact with what their methadone doses are and if we can titrate those at all to correlate with what they're asking us to give them.
Yeah, people really get offended when you bring their little marijuana little habits going on, they got going on. And it's so sad because it's like, I definitely support legalization of it on a nationwide basis and state by state, but not because it's healthy, because I think they got those two confused. It's because I'm tired of cops fucking with us. I mean, really, that's one less thing you can fuck with us over. So that's why I want it legalized. Give you one less thing to fuck with me over. Okay? Now, reality is, it's just as damaging as cigarettes, if not more, because you think it ain't. Yeah. So that alone makes it more damaging. Okay? Because you under the auspices that this is natural. Okay, well, tobacco was a motherfucking leaf too. So what about that? They all leaves, okay? Because you use that a lot. They just leaves, Shelly. Well, that's what tobacco is, boo. It's a leaf, okay? So the reality is, it's not so much the leaf, it's the smoke. The actual smoke causes what for 1 hour? Vasoconstriction. So you cutting off your circulation to your body for 1 whole hour, no matter what you smoked. You do the same thing if you work at LTV Steel. You do the same thing if you work at B&M Ribs, cooking some ribs on a grill. It's smoke. And it causes vasoconstriction. And it activates platelets. And it suppresses your immune system. And that's why so many young people are so sick all the time. Because they don't have an immune system. They're smoking all kind of shit. Okay? So we want you kind of be aware of that nonsense. It's just stupid.
So when it comes to vaping, is it the chemicals in the vape that's so much harmful?
Yes, if you notice with vaping, you still have smoke.
Right.
It's the smoke.
Oh, so it's just the smoke.
It's not just, but it's primarily a lot related to the smoke itself. Yeah, vaping is pretty seriously becoming more of a problem than even cigarettes, because people done went crazy with it. It was a transition off cigarettes. Now it's just what the fuck everybody do. Don't know what to do with that. And if you weren't here earlier, I mentioned that if you are caught vaping or someone reports you in this class for vaping, you're getting the fuck out of my life and this room. Because you are nurses and you're putting the people in this room at risk for asthma attacks. And I've got people in here with kidney transplants and looking for a transplant, so they're very suppressed immune-wise. I've got people in here on chemo. So you want to fuck with me? Bring it on. I'm not your girl. I'm not that girl at all. I don't let smoking, vaping, nothing go down in here. And when COVID was alive and well, you had to be fucking vaccinated to even come in here, because I have so many immunosuppressed. So I'm all about health and not so much about that nonsense y'all on. Okay, so just know that's gonna get you on my bad side. And you paid me, and I'm keeping it. But you get the fuck out. Okay? Okay, babies, moving on. You see here the passive-aggressive response. I don't see this that much. I see, probably the only thing I can say that I see is with cancers, lung cancers, maybe a doctor I haven't seen it with nursing. Maybe a doctor would say something along the lines of, well, I mean, you do smoke. Like, okay, where you going with that? Okay. That is just a passive aggressive response where you could have used the opportunity to talk to them about, number one, no one deserves to get cancer. I don't care what you do and what you did. And number two, I don't want it to get any worse. So you tell me what we can do together to help you stop smoking. Because I got to get you there with me. This is only going to get worse. So you see how we took the issue that caused it and we used that. We didn't ignore it. Don't do that. That's stupid. Don't do that. But we took that vice that you're struggling with and we tried to figure out how to help you with it. That's what we're supposed to do. Because I don't know if you know, but I do. Smoking is more difficult to stop than cocaine. It's way more difficult. In fact, we have people who stop cocaine and cannot kick their cigarette habit. So you need to always show compassion, always, when it comes to this patient has lung cancer and they are smoking, okay? Because my papa had lung cancer and never smoked a day in his life. That's mesothelioma, right? So he heard his share of bullshit from different people. Oh, you be smoking like that? Bitch, I ain't never smoked. Okay, so, you know, people just assume. Yeah, okay? Okay, guys, now we have the arguing. This you are in trouble for. Oh my God, where does it start? Okay, probably the number one place I see this happen is when the patient is late for their appointment. Now we're going back and forth with them and, well, you was late in the first place and I don't even know if the doctor can see you and no. Come on now, what we doing? Why we arguing with the patient? And then we already talked about workplace violence. Now they getting crunk too. I mean, you ain't talking to nobody that's just gonna lay there and let you talk to them that way half the time. Okay, so being late for their appointment is probably the number one place where I see nurses cross that border, that line, and they go into arguing with the patient. Another one is they didn't take their prescribed meds when I already just told you that the average price out of pocket for blood pressure meds is $300. And now you all up in their face like, why didn't they take their meds? Their blood pressure real high, blah, 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 blah. Yeah, the number one reason is they couldn't afford it. And unless you're coming up off your pocket, well, yeah, step back. Okay, so the arguing, definitely I see that. I see that with the staff and the patient, nurses and the patient, doctors and the patient. I'm not sure where, you know, arguing comes into play in terms of caring about this patient. I'm not sure where you thought that was beneficial or therapeutic, but you just don't want to get caught up in that. It's not really worth it. And I will say this, that's going to be an ombudsman. That's good because a patient remembers every word you said, even though you're really not saying it to be horribly mean. You just stating a fact that you feel like, okay, they were late and you might not get seen and, you know, really that was on you and all this. I'm like, why? Jesus, why? So what should you do when the patient's late? What kind of leeway do we have in terms of minutes? 15, yes, it's 15 minutes. So they're outside of the 15. How do you handle that with the patient? Since it is the number one thing I see y'all arguing about.
I wait and see if the doctor is in.
Okay, that's what I do. I say, you know what, baby? I'm not sure what's going to happen, but I'll tell you what. Sit here for now. Let me go see if the doctor has a chance to see you and fit you in. It may be that you have to wait a little longer, but I'm going to see if he can fit you in. And to be honest with you, I know in my department, the doctors are going to be vibing off of you. If you go in there and be like, this bitch was late, man. Do we got to see her? They're going to be like, nah, cancel her. Versus, it's a patient out there. She got a couple kids. She having a hard time. This is her third time trying to make this appointment. You want to go ahead and see her and fit her in? They're going to be like, yeah, why not? I mean, really, we are a team and we play off each other. Okay, now there's some doctors, they looking at their clock. They looking at their watch. 0.0002 seconds, fuck her. We out. I seen that. They are those doctors, but that's really rare. It's so rare to see that. Most of us are a team and we're playing off each other. You want to go to lunch, so fuck her. You know, that kind of shit. Nah. Think about it. Just think about what's going on out here, right? Maybe it's a blizzard. Maybe her, Uber or Lyft was late. Didn't even have nothing to do with her. She been up since 5, ready, willing, and able. And keep in mind, in my department, you prep for this shit. So you cancel me, I got to do this shit all over again. I may not never come back. Now colon cancer walking around because you didn't want to see the patient that was late 1 minute. It's just wrong. At a certain point, it's just wrong. Okay? And needless to say, I see this done to blacks and browns way more than the majority culture. It's like they just out to say, fuck you. Okay? So that's just real. All right, so that is your non-therapeutic communication. Y'all got it. Now we're doing our procedures. So take out your procedures. Reduction of risk.